You want to maintain your result. You spent a lot of money. You spent a lot of time. You recovered. It probably was emotionally very challenging. To make sure that you maintain your result, your skin has to be optimized, but it will make sure that you maintain your skin quality, you maintain your skin texture, you prevent new pigmentation from forming, and that's going to prevent your result from kind of diminishing. And this is just a little bit of a glimpse into what actually you can find within this guide. I mean, this is just kind of one piece of the puzzle. Again, all of these pieces of the puzzle need to be working together. If you recently just invested money, time, and energy into your neck for a neck procedure, whether it's surgical or non-surgical, I have the maintenance solutions for you. So in recent podcasts, we talked about surgical treatments for your neck, as well as non-surgical treatments for your neck. Now, today, we are going to be focusing on maintenance for your neck so that you can maintain your investment and maintain your result. Hi everyone, my name is Dr. Brandyn Dunn. I am a double board certified facial plastic surgeon and the creator of Dr. Dunn's Neck Guide, your neck's best kept secret. This is our brochure. The guide is going to be on our website, full form, everything that you need on our website, and it's going to be incredible. So today, like I said, we're talking about maintenance for your neck. Today, we're going to be talking about the maintenance of Dr. Dunn's Neck Guide, the maintenance chapter after surgery in Dr. Dunn's Neck Guide. Let's go. If you recently had a surgical procedure, whether it's liposuction or a neck lift or a lower face and neck lift, you want to maintain your result. You spent a lot of money. You spent a lot of time. You recovered. It probably was emotionally very challenging. And, I want to make sure that you know how to maintain your result. It's not going to maintain without maintenance. If you were to buy a nice car or buy a nice house or buy anything, you would want to get it, your car's oil change. You need to fill up gas. You need to make sure that you wash it every once in a while. So if you want that car to stay nice and look good and you to feel good when you're driving that car, you have to maintain it. And that is the exact same thing when it comes to our face and our neck and making sure that we get the best possible result for the longest possible time. When we're talking about maintenance for the neck, we are talking about a lot of similar non-surgical treatments to be able to maintain these results. There are three major categories that I always like to talk about when I'm talking about maintenance. Number one is your skincare, your topicals and your skincare with your active ingredients. Number two is your toxins and your injectables. And number three is your energy-based devices. To make sure that you maintain your result, your skin has to be optimized. And what's happening during a surgical procedure is I am working underneath the skin. So surgical procedures do help and enhance the skin a little bit, but it's not its primary focus. It's working on the deeper structural tissue underneath, whether that's working on the muscles or the glands or the fatty tissue. It is working on that layer of the neck. That top layer, in order for it to still look good and youthful and refreshed and looking snatched and looking great, you have to maintain that. So active ingredients like retinols or tretinoin, vitamin C's, sunscreens. Oh my gosh, sunscreens are so important. If you are not wearing a sunscreen and it is not moving into your neck to protect it from UV radiation, you honestly should not invest in surgery. It's just not worth it. It's a waste of money and time. So now that you're wearing your sunscreen and you're using your good skincare products down into your neck, that's going to help to maintain the result. It's not going to be life-changing. It's not going to change your skin dramatically, but it will make sure that you maintain your skin quality. You maintain your skin texture. You prevent new pigmentation from forming, and that's going to prevent your result from kind of diminishing. It's not going to keep that result lifted and snatched and really well defined, but it is an important part of the equation. The next thing I'll say is your injectables, your non-surgicals and your injectables. So the first and probably the most important, obviously the neck guy goes into much more details and there's a lot of other injectables and non-surgical treatments that can be done, but the one that I want to talk about here, and probably the most important, is neurotoxin. Toxins, Botox, Dysport, Xeomin, Daxify, any of these are platysmal bands, the bands that we see in our neck, which are treated with surgery, typically with a neck lift or a lower face and neck lift. They are sutured together or they're plicated in the center during the procedure. It's through a small incision underneath the chin, but that nerve that controls those muscles is still active. we're not cutting the nerve fiber that innervates those muscles. So you're still going to have a propensity or a tendency to form those bands again, specifically when you're smile animating, doing facial expression. So in order to maintain those results and prevent those bands from reforming soon after your procedure, it is critical that you maintain them with neurotoxins regularly. Every 3 to 4 months after your procedure, making sure that you get neurotoxins to relax that platysmal muscle, that neck muscle within the neck, so that you prevent those bands. And this is just a little bit of a glimpse into what actually you can find within this guide. I mean, this is just kind of one piece of the puzzle. Again, all of these pieces of the puzzle need to be working together to make sure that you can maintain your results. The last piece that I'll talk about just very briefly is these energy-based devices. There's so many out there on the market. One of the things that I really love to use in my office is CO2 laser resurfacing. If you're a good candidate, that really helps with the top layer. That's kind of like a total system reset. It can be used much more, I guess the energy level can be much higher so that it can be able to actually give your skin a complete reset. This works in conjunction with your skincare, in conjunction with your neurotoxin, in conjunction with your injectables. So all of these things, as you can see, are pieces of this puzzle. And the guide is really where you begin to understand what are the pieces of this puzzle. Where do I start? What do I look? Is it worth it? Is it not worth it? Am I just getting scammed? Is this misinformation? Am I going to the right person that has my best interests in your results? So, that's why I created this. This is a completely free, obviously this is our brochure, so much more information on our website, link in our description. And this is where you begin your journey to understand how you can maintain your results.